Good afternoon, Miss. My name is Elizabeth Bellis, and I'm going to talk about of the stage of birth. Firstly, what is birth? Birth, also called childbirth, is a process of development of the child in the uterus of her or his mother. This process is described by the signature embryology. Birth, the stage of birth, we have four stages. The first one is the initiation of the labor. The second one is the second part of labor. The third is after birth, and the fourth is recovery. The first one, initiation of labor. During the first stage of labor, the contraction can help her cervix to think and begin to open. This is called effacement and dilatation. During this stage, the cervix will open about 10 centimeters. The first stage of labor usually lasts about 12 to 30 hours for the first baby and 7 to 8 hours for the second child. The first stage of labor have three parts, as you can see in this picture. The first one is early labor, the second one is active labor, and the third is transition to the second stage. The first one, early labor. The cervix becomes to dilate. The cervix open, as you can see in the hole, open to 4 centimeters. The contractions may go away if the woman changes her activities, but over the time they will get stronger. When the patient noticed a clear change in how frequent, how long, and how strong her contractions are, she is probably moving into the active labor. The second, active labor, as we can see the head of the baby, the cervix open from 4 to 7 centimeters. This is when the patient should head to the hospital. When she has contraction every 3 to 4 minutes, and they shall last about second. It often means that the cervix is opening faster, 1 centimeter per hour. Relaxing during and between the contractions save her energy and help the cervix to open. Many hospitals have whirlpool or sucking tubes that may help she relax. And the third is the transition to second stage. The cervix open to 7 to 10 centimeters. For most women, this is the hardest and most painful part of the labor. When the cervix opens its fullest, the contraction lasts about 60 to 90 minutes and come every 2 to 3 minutes. There is a little time to rest, and she may feel overwhelmed by the strength of the contractions. Okay, now we can see the second stage of labor. The baby moves through the birth canal. The second stage begins when the cervix is completely open, 10 centimeters, and ends with the birth of the baby. The contraction puts the baby down to the birth canal, and she may feel intensive pressure, similar to yours to have a bowel movement, as we can see in this picture. The contraction continue to be strong, but they may spread out a bit and give she time to rest. The length of the second stage depends on whether or not she has given the birth before and how many times, and the position and the size of the baby. The third is after birth. After the birth of her baby, the uterus continues to contract to push out the placenta. As we can see in the interior of the uterus, we can see the placenta. The placenta usually delivers about 5 to 50 minutes after the baby arrives. And finally, the recovery. The baby is born, the placenta has their belly, and she and her partner will probably feel joy, relief, and fatigue. Most of the baby are ready to nurse with a short period after birth, and others wait a little longer. If her mother or his mother is planning to breastfeed, breastfeed, she can try to nurse as soon as possible and her baby is born. Nursing right after birth will help to her uterus to contract and will decrease the amount of bleeding.